Welcome everybody. This is the Heart Workshop, or Don't Break Your Heart. I do a cardiac workshop about once a year. Let me start out by saying this. The things that I'm going to tell you tonight, if you've been listening to current thinking on cardiac health and your cardiologist, those things, this is going to be controversial to you. Okay. Now let me start out by saying I'm not a cardiologist. It's not my field. I'm a chiropractor, a nervous system specialist. But it just so happens that usually we're about 10 years ahead of what most people are talking about. And so if I don't step on your feet in your belief systems tonight, then you probably didn't hear me. Because I'm going to blow some of your minds on some things that are absolute. Listen, if you want research for anything that I talk about tonight, please ask me. I will make sure that you see that. It's not that I'm just saying something off the cuff or something that I just thought about. Everything that I'm giving you tonight is based on factual science. Institutes for Health, cardiology, all the rest. But these are things that are cutting edge that your cardiologist or your medical doctor won't know about either ever or probably not for years from now until it becomes mainstream. Does it make sense? And so we're going to go through a lot of things tonight. There are certain things that I want you to get. There are action steps that I want you to take. Everybody say the word action. Action. Reversing heart disease, which is also possible, and never having heart disease is extremely possible. It just takes what? What's the word? Work. Well, say action. Well, work is too. Maybe we should say work. But it's action. Action is what it's going to take, and action is what I expect. Now, there are some easy ways out. I wouldn't say easy. They're just actions. People who would rather exercise or take a supplement? Raise your hand for supplement. Raise your hand for exercise. There's some exercise in there. But let me just say this. Exercise, supplementation, there's a lot of things. There are supplements that I'm going to make sure that you guys get today, and you're going to get the science behind that. And everybody look at me. If something happens to anybody in this room, you guys are precious to me, and I've lived my life for one purpose, is that you guys don't just get your spines corrected, but we can live a successful life together until Jesus calls us home, and I think that should be a long, life-filled life, basically. Got it? Starting out, the number one cause of disease that causes death on the face of planet Earth is what we're talking about tonight. It's cardiovascular disease, which includes heart attack and stroke. Everybody got that? And we'll just go through stats. Is it bad? Yes, it's bad. Raise your hand if you know that it's gotten worse every single year forever. Yeah, it's gotten just worse and more worse and more worse. But we're looking at over $1 trillion bill for just heart disease coming up. Lost wages, medical bill spending. Where does all that money and resource come from? It comes from people being sick. And if I have my druthers, not that I don't like people, and I think there's some wonderful people in that place that save lives, but if we do this right, we should shut that down. Now, it's in children too. 25% of children already have plaque building up in their arteries, and 60% of teens already have plaque building up in their arteries. It was never like that before. What did I just say? I just said that children have heart disease. That's what I just said. It's undiagnosed, it's unsymptomatic, but they still have it. Why? Because of all the things that we're going to talk about tonight that you can reverse. And yes, you can reverse it, but it's getting worse and worse and worse. And this literally is where I want to start, okay? If you cut your finger today, it may have healed faster years ago, but irregardless, every single person in this room, guess what's going to happen over time to that cut on your finger? It's going to what? It's going to heal. Your body's innate, we call it innate, or just inherent, inborn ability to heal itself. That is a real thing, yes or no? Yes. Can you quantify it? Not necessarily. Can you weigh it? Is it on a blood test? No, it's not. But we know that every single person was born with the blessing of your body having innate intelligence in itself to heal itself. One of the principles of chiropractic, and this book right here is a green book, if you didn't know what it is, The Science, Art, and Philosophy of Chiropractic. Principle number 25, and there's 33 principles, but 25 says, the forces of innate intelligence never injure or destroy the structures in which they work. Which means to say, if your body made the decision to have your blood pressure high, and your things are right within you, but it's high, okay, then what it's saying is, it's making that judgment to do that on purpose, and it's better for you to have high blood pressure than low. What it's saying is, if it's making more cholesterol, and everything's fine with you, then it means that you need high cholesterol right now. Do you agree with that? Right? And so, like a fever, is a fever necessarily a bad thing? No, it's not. Now we know that if you actually decrease a fever, depending on who you read, you actually increase the likelihood of cancer in your lifetime if you give a child a fever reducer every time they have a fever because they never develop an immune system. So there are things that your body does that are the right thing at the right time. You need to understand that. Got it? And we're going to start with a couple things. And I told you I'm going to step on your feet. So listen to me. First thing I'm going to talk about is cholesterol. Got it? Okay? In 1984, it came out on Time magazine and said, the bad news is that cholesterol is bad, it's killing people. And this began the rush into the pharmaceutical craze of what? Statins, cholesterol drugs. So we gave everybody statins. Now back then, your cholesterol had to be over 300 something. Then it was 300. Now what is, quote, normal healthy cholesterol? Should be 200, right? But nobody read this in 1999. They just blew right past it. In 1997, they said, oh, guess what? The good news is what? Cholesterol is what? Good. The reason that it took that long is because we found out 15 years later that cholesterol, your body makes that. 80% of your cholesterol in you is made by you, right? Not your dietary. You made it, and it is there to protect you. It is a repair substance. Anywhere there's inflammation, anywhere there's cancer, anywhere there's a problem, your body sends cholesterol to it so that it helps heal it. Make sense? Your body wouldn't do something, right? Doesn't do something to injure itself when it's working right. Okay? But what do you see? Well, what is it? Cholesterol is basically just a waxy substance. Make sense? It's just something. For instance, if I've got something that's broken down in a blood vessel wall, right, and I've got blood cells going around a corner, and I get a worn and torn corner of a vessel, and those blood cells just keep hitting that, I'm going to eventually put a hole in it, yes or no? So you're going to create a reaction, an inflammatory reaction, and your body is going to bring cholesterol to that area, and it's going to put a patch around that. Thank you, Lord. Well, that was awesome, and I didn't have to think about it. I didn't have to learn how to do it. I didn't have to get an A on a test to get there or a certificate on the wall. My body knew how to do that from day one. Got it? Awesome. The problem with it is we saw cholesterol in people who were dying of heart attacks, and they had elevated cholesterol, and we actually put two and two together, and we thought, well, I guess the cholesterol is bad. And let me tell you how bad that is. That's not good science. That's like, I know this is a quirky way to think about it, but just it's a good example. Let's go outside. Let's say that somebody hit a bird, right, with their car, and it's been a couple days, and there's like maggots on this bird on the side of the road. It would be like looking at that going, wow, man, those maggots jumped up and killed another bird. Like, did the maggots kill the bird? No, but if you looked at it and every time you saw a dead bird, you saw maggots, you could put two and two together and say, well, man, those maggots, man, they're just vicious. Right? Do you see that? Just because someone has high cholesterol and they have plaquing in their arteries doesn't mean that cholesterol necessarily caused it. Possibly they have a mechanism within them that is oxidizing cholesterol and causing it to plaque within arteries, and it's not the cholesterol in and of itself. How about that? And guess what? That's what we're going to go through. There is LDL and HDL. Everybody knows that? Now I'm going to educate you. There's so much information tonight. If you guys don't catch everything, we'll hopefully have it back on the website so you can see that in a couple weeks. But just listen close as much as you can. Take notes. LDL, HDL. What's LDL stand for? Low density lipoprotein, high density HDL. Which is the bad one? Low. Supposedly, high is the good one. Now, just so you know, that's an absolute farce. You have to have low and you have to have high. There's no such thing as good or bad. In fact, I hate it when doctors say that because everyone wants to get the LDL crashed low, but every time you do that, we skyrocket. You don't have the ability to heal the surfaces because the low density is actually what patches things and stuff like this. Now, I will say this. If you want to talk about cholesterol and its relationship to heart health, what you have to look at is particle size. And so if you have large particles of LDL, they don't oxidize as fast. If you have smaller, tiny little particle balls of LDL, they oxidize more readily. Make sense? Right? And so it's not the cholesterol, but the oxidation of cholesterol. And we'll go through what causes that here in a minute. But I just wanted you to make the differentiation between the two different types that everybody talks about, and it's LDL and HDL. Okay? Now, it talks about oxidation right there. Now, the truth is that more people have heart attacks with normal cholesterol than low cholesterol. In fact, watch this, there's a higher death rate if your cholesterol is low. In fact, when we kept bringing it down, in fact, who made the number from 300 down to 200? Who made that decision? Say it. Yeah, Jill said it. The pharmaceutical company. They did the research. They said that actually we got it wrong. We think that the healthier cholesterol is down here. What happened to the amount of people that needed a statin drug when they brought it from 300 down to 200? It went up, don't quote me, but I think it was like 10 million people needed more statin drugs. Okay? Did you get that? That's a lot of money, okay? What happened to heart attacks, heart disease, and death by heart attacks when we actually went from 300 down to 200? Guess what happened? It increased. Guess what happened to cancer rates? It increased, okay? Now, the dangers of it. All I want you to look is at the bottom. Now, you can look at the rest of it, especially because it stops CoQ10 and it causes depression, causes all kind of things. But every single drop that it goes down, every point that it goes down, the researchers followed 114 patients, every point that it goes down increased the risk of death 36%. Did you get that? So if you went from 220 down to 215, did you get that? That's 5. Do 36 times 5. That's not a good percentage increase in death likelihood. Did you get that? Is everybody with me? Yeah. Did you know this? This is crazy, okay? Now, the other thing that causes is your brain literally uses, 80% of your brain is made up of, guess what? Fat and cholesterol, basically. It's a fatty organ. And so if you actually take a cholesterol-lowering drug, you start leaching fats from the brain, and you actually start causing dementia. Right now that they're theorizing, they don't know for sure, but they're theorizing there's more than 500,000 people in retirement homes and memory centers because they have what's called, it's a diagnosis now, and there's a code for it, statin-induced dementia. And the problem with it is, if your family member is on a cholesterol-lowering drug and they have dementia or Alzheimer's, because there's almost indistinguishable, but guess what? They may leave them on that from here on and not know that's what's causing it. Okay? Now, it is so prevalent now that there's actually a book out called LIPITOR, The Thief of Memory, and the guy that wrote this was a NASA astronaut who actually was put on LIPITOR, and he had amnesia so bad he went to the same grocery store twice, and when he got the groceries to put them in the trunk, he opened them up, and the same exact groceries were sitting in his trunk, and he freaked. And he had done the same thing already once before, but he had amnesia. And it was from being put on a cholesterol drug, and that's what started him into the research. Got it? It's just not something. Now let me say this. I also do not make medical decisions. I'm going to go through blood pressure meds tonight. I'm going to go through statin drugs tonight. I legally cannot tell you not to take a drug. I want you to look at the stats, look at the research, and make your own decisions and work with your doctor and ask your doctor these things. Yes, Jill? You got her back. Thank God. Isn't that awesome? So she was in dementia, took her off, and she came back. That's awesome. And my grandmother was the same way. She literally was gone, and they took her off the drug, and then she came back to us. It was awesome. So sometimes it's too late, but sometimes it's not. Dangers of statin again. So here's the thing. Brain tissue's made 60% cholesterol, and it depends on the fat and how you're looking at it, but it causes depression. We had a lady that worked for us one time. She got put on a cholesterol drug. She went into a deep depression, so rather than taking her off the cholesterol drug, guess what they did? They put her on an antidepressant, and actually about 4 months later, the antidepressant and the cholesterol drug caused diabetes. They put her on 2 diabetes drugs, and then she came to work for us, and she goes, man, I feel horrible. This is crazy. And so guess what? She started getting healthy, worked with a doctor. She's off all of her drugs, and everything went all the way back to all the rest. So it's not hard to get healthy. You just have to treat the cause and not the symptom. Got it? Okay, but we're talking about heart disease. How is cholesterol made in the liver? Okay, now everybody look at me. Look at me, not the screen. Relax. This is complicated. All I want you to look is the top and the bottom, okay? So we put a bunch of stuff, crazy stuff up here with lots of letters, and at the bottom, what comes out? Cholesterol, okay? Now, the first step in all this hodgepodge of stuff that I had to know at one time for a test is a enzymatic reaction with what's called HMG-CoA reductase. Okay, now it says statins next to it. This is what statins affect. So they basically X that off right there. Got it? So there's lots of steps in here, which is why a lot of times you can bring it in from another area and still make this cholesterol. But this is what statins do. They chop it off right there. Got it? So they inhibit HMG-CoA reductase. Got it? Now, what that does is it basically squashes the ability for the liver to make a lot of cholesterol. Okay? So, and this is for later, magnesium regulates HMG-CoA. This is another reason why it's good for the heart. Okay? But what it does is cholesterol inhibits, negates the use of CoQ10. So it negates your CoQ10 stores, okay? And I'll talk about that here in just a little bit. But there's another thing I want you to get. If you decrease your cholesterol, there's another reason for cholesterol. Not just brain, not just healing arteries, not just decreasing inflammation, not just decreasing your likelihood of cancer, which, by the way, when they took LDLs and they put it in a petri dish with cancer cells, guess what happened to the cancer cells? They died. And then when they started looking at people with lowering LDL levels, guess what they found? Temporal relationship 100% across the board, basically. I don't think anything's 100%, but guess what they found? When you lower your LDL, guess what you get? Diagnosis of what? More cancer. But watch this. Cholesterol, now I know this is a blah, 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 it's busy, okay, but watch. Cholesterol is at the top of this one. So it's at the bottom of this one, okay? So I'm chopping it off here so I don't make this. So I'm not putting this into this pathway here. And this is a pathway of how I make all my hormones. Got it? So if I'm making hormones and I don't put cholesterol in, I don't make pregnenolone, progesterone, aldosterone, so my kidneys, I start having swelling, especially if I'm on a plane or at the end of the day, or if I drive in a car, okay? Or if I eat anything salty, boom, everything swells up. Cortisone, stressed out. If you have any female reproductive issues whatsoever, low testosterone, you'll see all these things. Or if I can't adapt to stress like I used to. You'll see this a lot of times when people are taking cholesterol drugs because it decreases your ability to have cholesterol come in. Everybody got that, right? I just want you to see some pathways. But all I want you to get is, do you see how cholesterol is a major player in your body working, healing, and functioning the way that it should? Yes or no? Yes. Got it? Is it the enemy? No, it's not. Okay. Now, fat holds the answer, okay? One thing you're going to see is, and we're not going to talk about it now when we go into supplementation, is the answer to the fat you guys are eating is in the ratio, okay? And we'll get into that. This is one of the solutions tonight. I'm going to go into it later. Should I lower my cholesterol? Okay? And the answer for most of you is going to be no. Actually, I just went over guy's cholesterol tonight, and it was 237, but he has a disorder that his body is always having to deal with, and his cholesterol is 237, and actually I'd like it to be a little higher, which sounds really bad, right? I'm not trying to make medical decisions. In fact, he's working with his doctor. But my point is, listen, you probably want to get that what? A little higher so you're in a safer zone. Again, until you get into that, depending on the person, your body style, and your lifestyle, until you get to that mid-200s, you're probably not where you want to be. Got it? But so many people try to do a low-fat diet and it just wrecks you. In other words, it's been conclusively shown, watch this, that lowering cholesterol saves lives. No. In fact, several large studies have shown that lowering cholesterol into the range currently recommended is correlated with an increased risk of death, especially of cancer. Did you get that? You do not want cholesterol the way that your doctor says you want your cholesterol. Would you agree with that? Okay? Not based on Dr. David, based on what the research shows you. Everybody with me? So next time someone says that your cholesterol that's 220 or 250 or 260 is life-threatening, what should you do? No. Okay, I'm officially off the Christmas card list of every medical doctor in Dallas. So for all the lawyers, they're going to contact me next week. It's 255. No, just bring them the research. They just don't know it yet. Now, they may not like that very much, and if we're very prideful, and sometimes I get into that too, we may not like you bringing us stuff or whatever else. I kind of like it. But you may have to find another doctor, but they probably need to know. Got it? Okay? Now, let's talk about blood pressure. Okay? Now, I opened a clinic in Africa. Listen, just so you know, hippos are not nice petted. Like, you can't, like, they kill more people than any other animal. Did you know that? Like, hippos are dangerous, like very dangerous. And they're fast. I don't know how fast they are on land, but on water, they're like, boom, they're like a rocket. Now, let me, you're just hungry, even though they don't necessarily eat people all the time. But now, what do you think this guy's blood pressure is?
Very high.
You think it's high? Yeah. Now, if he runs the corner, gets over a wall, that thing can't get him, and the wall he jumped over was an office for a medical doctor, and he ended up going in the door and sitting down, and somebody took his blood pressure, what do you think the doctor would say? Oh, my Lord, you're going to die any second, right? But watch this. How many of you are metaphorically getting chased by a hippopotamus every day with your work and your deadlines and the stress and the making the ends meet, and you got that one relative or the child that's getting crazy, or you're, right? Anybody? And it's with you all the time. Who here, just raise your hands, got behind the shortest line of cars at the red light just to get here tonight? I'm just saying, I'm not trying to read your mail. But when you live lives like we live, and we try to get so much in, you're going to have blood pressure that's high. Now, let me just give you some cool things. In 37, Paul Dudley White, who suggested that hypertension may be an important compensation mechanism, should not be tampered with. He said, even if we were certain that we can control it, he said, you probably don't want to mess with it because it's part of the body's adaptive mechanism. And if you mess with the body's own adaptive mechanism, you're probably going to mess something up. Do more harm than what? Than good. And what is the oath that all doctors take? Do first do what? No harm. We left that one a long time ago through what I think. This was actually taught in every single medical school for the longest time. It's a 1949 text from Charles Friedberg, and he said mild benign hypertension, which is defined as what? So when's the last time somebody said mild when your blood pressure was 210? If your blood pressure was 210 when you went somewhere, guess what they'd tell you? We're going to admit you to the hospital right now for observation and make sure we get that down. We're going to give you 3 IVs, 14 medications, about 19 hours of observation to make sure that you're fine. Right? Because they're going to talk you into you're going to have a stroke. And they just speak into you. You're going to have a stroke any second. But there are doctors for years and years that said that 210 was just mild benign. He said, don't do anything about it. And I'm telling you this because it's the same thing. And I don't want to get into it. I'm just going to use it as an example and then shush it. Measles, we used to have measles parties. Back in the 70s and 80s, some of you guys aren't old enough for that, right? We had measles and chickenpox parties, right? It wasn't any big deal. And now you say measles, and people are like, oh my gosh, we're killing the world with measles. Everybody's dying. Like, things that weren't a big deal are now a big deal because we have trained people that they were a big deal, and we've trained people to be scared of it. Be scared of your cholesterol. Be scared of your cholesterol. Be scared of your high blood pressure. Be scared of your blood results, those things. Make sense? When a lot of those things are changing based on what a pharmaceutical company said to sell them a bunch more drugs. Okay? Now, how does this blood pressure relate into this? Just like the running from the hippo, right? I mean, it's a constant stress at work. I'm trying to eat while I work. My ladies that I take care of, I have so many moms here. You guys need to hug the moms in my office who bring their kids in. I had somebody the other day that was waiting for an adjustment, and I was adjusting 3 kids next door, and she was like, ooh, I'm so sorry I got behind that family. And I was like, what do you mean? She was like, well, I go, man, can you imagine what it takes to get out of the house, to get everybody's hair brushed, to get all the dresses and cute little shoes on, and to get all the way here, and to get the number, and to sit quietly, and to get into the room, and get everybody's, like it's awesome. But I'm just saying, this is the life that a lot of parents and a lot of people, I actually had another family that's come in, they go, we were retired. I don't know how we got it all done before we retired. They seem so stressed out. We have so much stuff to do. I was like, it's going to be okay. We're going to get there. But stress, listen, when you guys have stress, you don't wear your stress on your shoulders. Like everybody says you wear the weight of the world on your shoulders. You don't wear it on your shoulders. You wear it where? Right on your heart. And it's a real thing. Now, I'm going to do something fun here real quick because this has to be a real short workshop tonight. But I want everybody to close your eyes. Close your eyes. I did this the other day a little bit, okay? No peeking. Now, I want you to imagine the best vacation that you've ever had, okay? Whether it's mountains, whether it's beach, whether it's snow, whether it's warm. I want you to imagine the best vacation you ever had. Now, I want you to imagine the sun there. I want you to just keep your eyes closed. Just raise your head up and put your face in the sun, right? Now, how does that feel? Now, I want you to imagine what it smells like there. What's the breeze feel like on your skin, on your arms, legs? What's it feel like, the breeze? Now, what's your day like? You don't have it's not packed with things. There's not a gajillion things to do. How relaxed are you? How excited are you for your day? Now, relax. Now, everybody open your eyes. Wait, some of you need to come back. Come back. Come on back. I don't want to come back. Now, guess what happened to your blood pressure just now? It went down. Guess what happened to your heart rate? Went down. Guess what happened to your cortisol levels, actually? It went down, right? Guess what happened to your ability to digest food? Just kind of went up. Like, Everything got better just now. Do you know why? Because your sympathetic drive or your fight or flight just went like this. Now, there's emotional feedback. You can call it whatever you want. But there are techniques that are just like that. And that was not hard to do. Did you see that? Now, do you realize you can do that anytime? You literally can go there anytime you want and decrease that. And the effective people that do this will actually do that regularly, especially when they're extremely stressed out. Got it? I know there's nobody here like that, really stressed out. But if there was anybody, you could try that. Got it? Easy stuff. Here's the other thing. If you decrease your sleep, I'm just trying to give you some action steps for you guys to take notes. If you decrease your sleep 30 minutes, you miss 30 minutes a day, you actually decrease your insulin sensitivity by up to 30%. So guess what? Guess what happens to cortisol? Goes through the roof. They're inversely proportional. You end up having a jacked up cortisol, and so your ability to adapt to stress is worse, and guess what happens to your blood pressure? That's why if you guys miss or you stay up late or you something happens, you get woke up or you emergency happens and you're awake, guess what happens to your blood pressure? Heaven forbid you go to the doctor if you miss sleep, right? You guys with me? Yeah. So blood pressure, cardiac efficiency, ejection fraction ratios, all those things. But stress is a real deal. Now, positive protects. How about this one? This is awesome. This is from a Harvard magazine. It says, a sense of enthusiasm, hopefulness, and engagement in life and the ability to face life stresses with emotional balance, watch this, appears to reduce the risk of coronary heart disease. Watch this. Distinct and measurable effects even when you take into account of all the good lifestyle stuff. What it means is just as important as you exercising or eating right is you having a level of hopefulness, engagement, and enthusiasm. What is hopefulness? Anybody? What is hope? Hope's a positive expectation for the future. Do you guys wonder why it is when you come get an adjustment, oftentimes I don't say, hey, how's your day going? Now some of you guys do because I know the answer. What do I usually ask you? Are you ready for a great week? How great has your week been? Are you ready for a great weekend? Why do I put it that way? Because what am I trying to mind virus into your brain?
Positivity.
Yeah, enthusiasm. It's going to be better. You guys see that? It's awesome. Everybody with me? Okay? So sleep's important, enthusiasm, hopefulness. And listen, I meant to bring it up here. If you don't have a Bible and you're not reading that, it's like you have $1 million check in your bank account and you just decided not to cash any checks off of it. And so a couple things if you're taking notes, Deuteronomy 28 and Psalm 91. That's going to be your prescripture for tonight. Did you get that? It's a play on words. You just laugh anytime you want. Okay, these are the jokes, folks. All right, how about this one? A sense of purpose reduces the chance of heart attack and strokes. People with a sense of purpose are 23% less likely to die prematurely from any disease and have a 19% reduced risk for coronary or heart attack or stroke. Raise your hand if you'd like to decrease your likelihood of a stroke or a heart attack by at least 19%. Guess what? Just have a reason to be here. Did you do that? Just have a reason to be here. If you do, listen, who knows that the average person only lives 2.5 years after retirement in the United States? Did you know that? Because when you retire, you lose a purpose. Do not retire unless you got a reason to retire into. Got it? Or you will really retire. Got it? Got it? So, now, fight or flight. Parasympathetic versus sympathetic. What you guys don't realize is, we'll talk about this with the nervous system as well. When you are running and gunning from one thing to the next, is that parasympathetic or sympathetic? Sympathetic. So sympathetic is the drive. Blood pressure, adrenaline. Parasympathetic is, man, the beach is nice today. Yes. Woo! Vacation. Yes. I'm going to sleep in. That's parasympathetic. Relax. Okay? Which one do you think more people hit? Exactly. And when they are unbalanced like this, when they're like this, it leads into heart disease. And we're going to talk about that when it comes to your nervous system here in just a second, okay? I wanted to give you some ideas on this because most people don't realize that when you're working with your doctor has been told, even when your blood pressure gets normal, even when your, quote, cholesterol gets down to normal, will they take you off your drugs? No, they won't. The standard of care says achieving normal blood pressure and maintaining it for a year or more, although rarely is treatment stopped entirely, which means they're going to keep you on your drug. So don't just get discouraged. If you get it to where you want it and your doctor doesn't want to take you off there, just have another medical doctor, find another doctor, right? And have somebody that will work with you to get off the drug. Got it? Okay, simple as that. But this is what the experts recommend for heart disease. Okay, look at this. Stay on your what? Medications. Now watch this. Also eat low fat, low saturated fat, and low what? Cholesterol. And yet, and I like the other ones, fresh fruits and vegetables, brisk walks, and don't smoke. But this here will put you in an early grave. Got it? And I'll talk about why here in a second. Let me ask you the question. Will expert advice ever fix the problem? No. It won't, as long as the expert advice is standardized medicine that deals with the current levels as they are. Does it make sense? Okay. If you don't follow them, exactly. Now let me start with this. So how about blood pressure meds? Does anyone know the history of blood pressure meds? Back in the 60s, there was a guy looking at pit vipers in South America. And what he found was the way that snake kills its prey is they have a massive drop in blood pressure. So the venom, they hit them, and it goes into the bloodstream, and then they lose all their blood pressure. They can't sustain oxygen levels, and the creature dies. And then the snake eats them. Got it? So the guy goes, huh, that's weird. Huh. So he milks the snake, and he actually takes it to a pharmaceutical company and says, I'm theorizing that we could actually localize and synthesize the exact thing in the snake venom. We'd give it a little bit, and it would decrease the blood pressure in somebody, and we could actually use it as a solution to high blood pressure. And guess what? Every blood pressure, an ACE inhibitor, lisinopril and all ACE inhibitors, that's what it is. It's synthesized from pit viper snake venom from South America. And the researcher took it to a pharmaceutical company, and 2 scientists took it, and they've made it, which is why, if you look, side effects, extra water, extra urination, erectile issues, weakness, cramps, all your electrolytes being off, intense and sudden foot pain. Some of you guys don't even realize that that's from your high blood pressure med. Asthma symptoms, cold hands and feet, depression, anxiety is another one, heart palpitations. And this is what a lot of people don't understand. The way that the ACE inhibitors work is it actually has to, angiotensin 2 in the lung is what helps convert it. So it actually, the drug works by going through the lungs. Okay? And in doing so, if you're sucking down snake venom and it's doing something to your lungs, you might have some lung damage. You see that? And there is a percentage of people who start getting a dry, hacking cough as a result of swallowing snake venom, and it causes damage to the lungs, and it's misdiagnosed as pneumonia. Well, if you got pneumonia, what do they give you? Antibiotics, then steroids. And they keep giving you steroids, and it clears up a little bit, and then it comes back, comes up. There are a lot of people who've lost lungs or lobes of lungs because they were put on their just look it up, on their blood pressure med, and it actually destroyed lung tissue. Make sense? But constipation, dizziness. I'm putting this on here, swollen ankles, because I want you guys to realize that people are swallowing snake venom. Got it? Now, I'm not saying that there's not a time for medicine. I'm just saying you should know where it comes from. Like, people put so much faith in it, right? Like a snake oil salesman, right? Officially, that's not me. That's the medical doctor. How about this? Correction of blood pressure. There was an 84-year-old chiropractor who they upset, and there was a medical doctor who basically challenged him on being able to control blood pressure, and the guy actually had stuff in, there's a journal called the Journal of Hypertension, and it's basically human hypertension. The whole journal is about hypertension, so high blood pressure. Now, first of all, there's a problem if so many people in the United States have high blood pressure that there's a whole journal about it, okay? But next, what they did was they did a study, one chiropractic adjustment to C1 over an 18-week period. Don't quote me, it's either 8 or 18. But it was months. Not like every week, 3 times a week. One adjustment, and then the 84-year-old guy just left him alone. And then the medical doctors gave them control group, nothing, another group, this medication, another group, this medication for blood pressure. And what he found was the adjustment actually lowered the blood pressure 14 points greater than both of the meds combined, and the lower number 8 points lower than both of the meds combined. One adjustment over an 8-week period. And the other guys had to take the meds how often? Every single day. Do you get that? But when it hit the news, guess what the news said? It was on every news channel, and all the news channels, all they said was, well, it's very interesting, and we'll just have to do more what? Research. And guess how much more research they did? But guess how many more drugs they gave? And they've never gone back to it, right? I had a lady here the other day who got adjusted. She's fairly new in the office. I don't think she's here tonight. She got adjusted, and she was having blood pressure. She's just started. She goes, you know, I took my blood pressure today. It was like 225 over something. I go, well, you know what you should do? Is it electric cuff? She goes, yeah. I said, just put it in your car, get adjusted, and then when you finish your stuff and you get in your car, take your blood pressure. And she goes, oh, okay. I'm like, put me to the test. I know this works. She texted me, and I didn't get it till I was done with the shift. She goes, hooray, in her text. And she goes, my blood pressure is 125 over something, right? You see that? Bring it. Test me, okay? Actually, I had another mom the other day. She brought a little baby in. She goes, well, you know, he's constipated. And I go, yeah, right there. I adjusted him. She goes, that's it? I go, oh, yeah, that's it. You can text me an emoji later. She texted me like 2 hours later this big emoji of poop. It was awesome. Yes. So it works. So that's what doctors recommend. What do we recommend? Okay, what we recommend is just working with the body, not against it. Now, we're going to talk about diet. We're going to talk about mindset, so stress, nerve supply, oxygen, lean muscle, which is exercise, and toxicity. Now, we're not going to go through all of those tonight. We're just going to hit some key topics. I want to make sure everybody gets their resources, which are right, and there's some things I want you to stay away from as far as resources. Anybody know that there's certain supplements and things that you can take that increase your supplements that increase your likelihood of heart disease? And I want you to know that for sure, especially the ladies in the room. Okay? But get to the cause. Cholesterol is increased due to inflammation. Everybody say inflammation. It was in Time Magazine. The Time Magazine said that inflammation is the cause of heart disease, and it is. It's not cholesterol. It's inflammation. Inflammation causes oxidation. There's a lot of things that cause inflammation. Subluxation does, stress does, sugar does, oxidized fats do. There's a lot of things that cause inflammation. Injury does, but again, physical, mental, chemical, emotional, nerve related, but we're going to talk about getting to the cause. Now let's just start with causes of heart disease. The majority of heart attacks happen from you can't get blood through a tube. Everybody got that? Basically, this right here happens, okay? Now, what I want you to see on this is usually caused not by a plaquing that closes the whole thing up, but the lumen, or the hole in the middle, getting closed off because the wall from inflammation and scarring gets thickened. Everybody got that? What's the solution medically when they go in and see a coronary artery or something like that and they see that it's occluded? What do? Everybody say it. Stents. They want to do a stent. What's a stent? It's a little spring-load thing. And they put it in there, release it, and it spring-loads it open like this. Okay? Now, they actually just had a recall, I think it was a year and a half ago, and they were medicated stents. So they were coated with medication, so they put that in there, and then you just had meds just dissolving off that thing for years, and they said that actually increased people's heart disease. Now, the problem with it is, if you never fix the cause of this, but I just go in there and try to spring-load this thing open, do you think that's a solution long-term? No, it's not. Actually, Dean Ornish, raise your hand if you've heard of Dean Ornish. He was a doctor for Bill Clinton when he had a heart attack when he was a president. And he helped reverse him. Actually, Dean Ornish has a clinic. And he's shown, along with Edelson, who also is a 77-year-old guy who teaches every single month on this, on how to reverse occlusion of coronary arteries and everything else. And raise your hand if you know that you can reverse plaquing. Some? It is an absolute. You can reverse plaquing. There have been people who have been scheduled for quadruple bypass surgery, said no thank you. They just did what Dr. Dean Ornish is talking about and Edelson talks about, and they literally go back and look at the arteries, and they are open, and even better than any surgery could ever have done. Now, are there times for surgeries? Yes or no? And it's not I couldn't tell you when it is, yes or no, to do that. I'm just saying what you ought to do is act as if you already got it, and then do what? Just reverse it now. Now, before I get into the solutions on this, let me say this. If you look up Dean Ornish and what Clinton did to reverse his heart disease and all the rest, what you'll see is that it's plant-based. In fact, what they'll tell you is you want to not eat anything that has a face or a mom. Seriously, anything that has a face or a mom. No cheese, no dairy, no meat, no eggs, just plant-based. Now, before I destroy this, let me just tell you, the reason that does work is because they're not discussing why it is the alternatives to that, like eating meat and those things, can be bad. Okay, so let me just discuss this briefly. Okay, they're saying stay away from oils and things, and it's because they don't discuss which oils to stay away from. If you ask anybody in standardized medicine which oils are bad, they'll always say saturated fat is horrible. It's terrible. Like coconut oils and olive oils, things. Stay away from saturated fats because they'll cause heart disease. You want to do more vegetable oils and good things like canola oils and things like this. But the reason they say that is if you take all the saturated fat out of your diet and you actually put in unsaturated fats, vegetable oils and things, you can yes or no, can you decrease cholesterol? You can. You can decrease it 8 to 13%. So they think if you're decreasing cholesterol, you're reversing heart disease. But guess what they found? Every time that they did that with anybody, guess what happened to their heart risk for heart attacks, cardiovascular? It went up, and so did their death rates, and of all types. And so Dean Ornish works right because you're staying away from a lot of these things. And for instance, for meats, are meats inherently bad? No, but when you eat corn-fed beef and stuff that has antibiotics and all these shots in it and hormones, is that beef bad? Yes, and when people in Texas eat meat, how much meat do we eat? I'm just speaking for myself, 72 ounces. That's what we have, 72 ounces. So yeah, but watch, if you look at all the, do you know there's so many, I can't even name them all anymore, there's so many populations where heart disease is almost non-existent. It's virtually not even there. This is a disease that you do not have to have based on every science in the world. But first of all, we want to decrease even good red meats, so you don't have to have it at every single meal, okay? But eggs are good, fats are good, saturated fats are good, nuts, seeds, coconut oil, olive oil, like all these things are good. Now you want to stay to plants, and we'll talk about that here in a second. But doing that is why the thickness decreases, because the inflammation decreases. Everybody with me? Right? Now, moving on. What else increases it? Sugars, grains, and refined carbs. When you guys do that, it literally causes inflammation. And basically what happens is this. The small little LDL cholesterol, the small particle LDL cholesterol, sugar creates a cascading event of inflammation that oxidizes those little tiny particles, and then they become ooey gooey sticky. And now guess what happens? Now we build a plaque that oxidizes, becomes hard, and then closes things up. But it's more triglycerides than it is cholesterol. Everybody with me? So what's one thing you want to make sure you stay away from? Sugar, grains, and refined carbs. Where is that? Everywhere. In every boxed food, in everything. Now, here's some things that you want, okay? Here we get into the solutions. Everybody ready for solutions? Raise your hand if you're ready for solutions. Come on. So first thing, fatty acids. There's a robust, I love that word, it's more than robust, research indicating that the risk of sudden cardiac death is reduced when consuming higher levels of what? Which is saturated or unsaturated? Saturated, okay? Next, vitamin D levels, essential in direct association with risk of dying of all causes, especially heart disease, but also cancer. And magnesium, the role of magnesium protecting against heart disease cannot be overstressed. Remember that when you're looking to supplement your diet with magnesium, go green. Why are plants green? What's the ingredient? Chlorophyll. Do you know when you look at chlorophyll, the middle molecule of what makes it green? The middle molecule is actually magnesium of chlorophyll. That's why if you want to get magnesium, guess what kind of food you eat? Plants, green plants. Got it? So you want to get it there. Let's just start with this one. Major medical study, okay, found that consuming a lot of omega-3s decreased your cardiac death. Do you guys like studies? The nerd in me just likes studies. Just prove it to me. So there's a study, reduces inflammation. And why does it reduce inflammation? It's because most people, if I actually tested you right now, most of you guys would be either 10 to 1 or 30 to 1 in your internal ratio of omega-6 to omega-3. Your omega-6 is so high that it instantly, anything I do to you instantly causes inflammation. Anybody done anything where you just, like, you've been in where sometime in your life it didn't take much and things were like, I just do this and all of a sudden I get this big lump on me like this? Like, you just inflame so easily. And then other times someone could have punched you and you wouldn't even have a bump, right? It's because inflammation pathways are sensitized, and you just don't want that. There's a time for it, but there's just not. It decreases inflammation. Who wants to wake up in the morning and when you get up, it sounds like this, like this, to get up out of bed, right? Inflammation. Okay, that was the '80s breakdance, by the way, just saying. So, but how you optimize that ratio is eat healthy fats. Okay, now this is a supplement because this is. Everybody asks me, well, what's the one thing I need to take? Or what's just a handful of things I need to take? This is it. And if you guys have ever been to a workshop with me, this usually comes up because this is an essential nutrient. And everybody here eats bad fats. If you ever eat out, if you've ever gone someplace else, if you've ever left the pan too long on the stove with the oil in it, you browned it, you eat bad fats. And when you do that, anything that's sugary or anything that's like desserts, it's all bad fats, Crisco's and things. When you do that, you have to have something that's constantly trying to get your ratio down. This is why it's good to live on this stuff, because it's always bringing your ratio. This is heart protective. Everybody got that? Cardio protective. Very, very, very good stuff. Also it's very good for your joints too. Okay? Vitamin D. Now this is cool, but this just freaked me out. Now you guys know the first 6 years of practice, all I saw was stroke rehab and brain injuries and those things. Watch this. Everybody look. For each 10 nanogram milliliter reduction in vitamin D, so every 10 points that yours goes down, watch this, the chance for healthy recovery in a 3 months following a stroke is decreased by almost half, regardless of the patient's age or initial stroke severity. What it means is if your vitamin D is low and you ever have a stroke, you better pray that it is higher than most people. Because if it's anything under 30, guess what? It means that the brain doesn't recover. And you have what's called spreading depression. That's why you always need to have a vitamin D that's very high. Got it? And nobody's vitamin D is up. Ever. Like even in the summertime, it's not. I had a friend of mine's mom, they live in, they're affluent, they live in Canada, and she lives in Florida in the wintertime. So she can get what? Sun. And so she stopped taking her stuff. He goes, Mom, I guarantee you live in the sunshine, you're still not going to get enough. And he tested her just to prove it to her. And guess what? It went down through the summertime when she was off of her stuff and she was in the sun all the time. You just have to have it. So this is an essential one, vitamin D. Got it? Right here. Make sure you get this. This is an essential. Got it? That's why it's part of your bundle tonight. Now, magnesium, I bring this up. Magnesium, everybody knows this is one of my favorite things, right? Does everybody know I take all these, but magnesium I take every single night of my life, because I stand on my feet on concrete and it just helps my legs relax and I go to sleep like this. But watch this. Do you know that magnesium is I got some funny facts. Is that okay? Can I get it to you? Magnesium is the 4th most prominent mineral in your entire body. That you have 1,345 separate receptor sites in every area of your body, in every organ of your body, every tissue of your body for magnesium. So, did you hear that? There's at least that many different things going on in enzymatic. There's 300 enzymatic reactions that absolutely require magnesium. So what is magnesium good for? Just about everything. If it's deficient, you're messed up. It's not going to happen. In fact, it is the #1 essential nutrient for electrical health of the heart. Did you get that? So arrhythmias, tachycardias, inverted T waves, things like this. This is why magnesium is so good. I had a patient come over to the house the other day. She had an arrhythmia. She was doing a detox. I adjusted her, gave her some magnesium, and guess what happened to the arrhythmia? Cleared up, settled down. It was way better. In fact, she said it was almost gone. Okay. Now, again, I'm not trying to make medical decisions, but when you have a cause and you fix the cause, then that's what we're doing. Okay. Magnesium. This is a really, really good one. Just if you're asking, my favorite flavor is raspberry lemon. Just going to throw it out there. Also, some of you guys don't necessarily, I think most people try to say like it, but there's also pro magnesium formula. This is what we give Zanae every day. We give her a little spoonful of this every single day. Okay? CoQ10, #1 supplement for cardiac muscle energy efficiency. Okay? Also, if you drink coffee and certain teas, it actually depletes your CoQ10. But this is why this is a really, really big one. Some of you guys will take, I took CoQ10 for a long time before I felt any different. But once my stores kind of built back up again, I needed 1,800 milligrams a day. And these are 60 milligram caplets. And so imagine I was taking a lot. But once I built back up, because I took the metabolics test, some of you guys need to take the metabolics test too. But my energy levels came back, and now people think I drink coffee all day, but I don't. Okay. Daily defense. The reason this is important is for antioxidant levels. One of the reasons that you'll have plaquing, one of the reasons you'll have scarring and thickening of the walls is because you have just chronic inflammation. You know, you guys, no one's perfect, and I don't eat perfect, and I don't have everything perfect. I mess things up too. Actually, I couldn't hardly walk yesterday. My back, I had a rib that felt like it was out or something like this. I'm not perfect. But I can tell you, when we do things right, it makes things easier. When you stay on products like this, it makes it easier. It helps you with your inflammation pathways and those things, so you don't have underlying symptom-free damage to blood vessels that create scarring that you wake up one day and go, I don't know how I got 99 occlusion of my coronary artery, I didn't know it, right? This is one of those things to help from it. Got it? This is an amazing thing. This is why it's part of the bundle, okay? Things to avoid. Medications. Statin drug is one of them. Okay, so listen, pay attention. Here we go. I'm going to give you things to avoid. I'm giving you things to take and things to avoid. Now again, I can't tell you not to take a prescribed drug. You need to work with your doctor, but I'm going to suggest to you do your research. Statin drugs, very cardiotoxic, and it is the height of irony that the very thing they want to give you as primary first line cardiac treatment is something that is so cardiac toxic. Okay, next one. Non-steroidal anti-inflammatories. What do they tell you? If you ever had a heart attack, take what? Aspirin a day. Or if you've never had one, take one so you prevent one, right? Guess what? 3.2 billion people in this study in data analysis, guess what they found? Guess what percentage of people had a positive benefit at all? It's low, I'll give you that. Guess what the positive benefit was, percentage-wise, of people? Zero, nothing. There was only negative side effects, and yet that hit the news waves, and guess what? They are still giving people aspirin. And what's crazy about it is non-steroidal anti-inflammatories, including Motrin, Advil, Aleve, all of these things, Celebrex, they're all in a category that actually is linked to cardiovascular toxicity and cardiovascular disease. The very thing that they want you to take to prevent a heart attack is causing what? Heart attacks. If your doctor doesn't know this, you better clear it up with him. In fact, if your doctor would like to debate it with me, and actually wants the research, have him call me directly. Give him my cell number. Got it? And for any doctors watching, you just give it to him. We have a lot of people on the website. Okay. Willow tree bark? There's some studies that actually show that it actually is good. It depends on the person. It depends on what's going on internally to them, how much their inflammation level is. But that is usually to decrease inflammation. And so it does, what's that? Yeah, but it's good. Depends. Right? My thing is, I just want you to be healthy. I just hate to give you something to treat something, right? I just want you to get something so you have all the nutrients you need so your body can make the decisions it needs. So, next thing, if you want the research, and guys that are watching, this is just 6 of them that shows there is no benefit to taking aspirin for your heart. Do you see that? Journal of American College of Cardiology, Journal of American Medical Association, Pharmacoepidemiological Drug Study, British Medical Journal, New England Journal, American Heart Journal. I just threw a couple in there, just so you guys that are watching from home or on the internet, you can see that. That is a bunch of hooey, okay? Allergy meds. Who here knows that taking allergy meds gives you a risk of heart disease, okay? Who here knows somebody that took allergy meds and had heart palpitations? Anybody? Or anxiety? This is what happens. It's linked to it. There are increased risk for heart rhythm disturbances like atrial fib. And you can buy them over the counter, so I'm sure they're safe. Next, now stop everybody, look at me. This is going to flip your lid. This is one of those OMG moments here, okay? But this, if you take calcium supplements, you need to realize 24,000 people in the study, ages 24 to 65, if you take calcium supplements, you are 86% more likely to have a cardiovascular event. And yet they want every single woman to take calcium so that you have healthy what? Bones. When in the world did it become the right thing to do to swallow bone and rocks and shells ground up? Like your body, it's just not right. Your body was not made to ingest bones and rocks and shells. Okay? Hello, right? So, not good. And that's from the British Medical Journal. Okay? And you start seeing this stuff like Citracal. I have patients come in with this. I'm like, no, let's get rid of that. Okay? Equate. Sure, it's got vitamin D in it though. I don't care. Right? Wheat. Again, if you're doing a lot of wheat, be prepared. You're going to have cardiovascular issues. 200 different documented adverse effects, and a lot of those are cardiac. Bad oils. Again, These are all the yeses, okay, but you want to have too much red meat. But these are all the no's, and it's because they lead to an inverse proportional ratio of 6-3, right? And they're just bad oils to begin with, okay? Now let me start on this. This is cool, okay? Now I nerded out. I got 9 hours yesterday going through this. I built this slide. I hope you guys enjoy it. This is my favorite part of the whole talk. You ready? Here we go. Let me just enjoy myself. Here we go. So, this heart, how much electricity does your heart use? Anybody? Up to 5 watts an hour. If you don't think that's a lot of electricity, let me hook you up to 5 watts, okay? That's a lot of juice. In fact, to give you an idea, because most people don't know what a watt is, if we all had a semi-tractor trailer outside that was out of gas, and we all got behind it to push it, you know how big a tractor trailer is, do you think we could push it? It's big. Do you know every single person in your heart has so much electricity it uses in every day, you could drive it just on the electricity from your heart for 20 miles every day. Now watch, it gets that much electricity, where does it get it from? It gets it from the brain. Now watch, do you think that there's any battery on Earth that has that much juice in it every day, all day, for 80 to 120 years? No. So the interesting thing was, Roger Sperry in 1982 won a Nobel Prize, and what he found was, he literally furthered our understanding of the brain to find that the brain actually works like a battery that recharges itself. That was in the 80s. In the 70s, they did a really horrible study with rabbits, and they actually harnessed electricity coming off of the brains of rabbits, and they actually hooked it up to an electric train, and they just ran the little train, and this rabbit would live its life and eat and run around with all these wires coming out of him, and then the rabbit would die, and the train would stop, and they'd hook another rabbit up, the train would start going again. Because there's electricity that comes out of this battery of the brain. Then Roger Sperry did his work. What he found was, though, he says, how does this brain keep getting charged up? And guess what he found out? It's the movement of your body that charges your brain. Got it? But this is what's crazy. He said your spine is like a windmill. Your spine produces the whole majority of the charge of your brain. So I put this in there, okay? Kind of looks like a spine. So imagine your spine is generating all the electricity to charge this. And then in turn, what he said was, it uses the energy for healing, thinking and functioning, including immune organ function, building immune globulins and a response and all the rest. So all the organs happen from the brain firing down like light bulbs, getting those things to work through electricity that this thing provides, which just by itself, the heart has enough electricity usage to push an entire semi-tractor trailer 20 miles every day. How much do you think all the rest has? Do you see that? Now, what happens when the spine begins to break down? Not even a little bit. Like this would be a lot, okay? But what if it's just a little bit? It's out of alignment. What he said was, he said the more structurally distorted we are, he's talking about the spine, high shoulder, a shift of the head, a high ear, a high hip, something like this, the more distorted you are, the less charge you can get into your batteries. And the less charge you have in your batteries, the less function you can have in the body. The less healing for joints, the less proper function of the heart. And eventually it's just a matter of time until what? Till something what? Shuts down. Why is heart one of the #1 disease killers in the world today? Is because when your brain doesn't have enough battery power and this thing uses that much, it uses more than anything else, yes or no? Yes. Then when the batteries start losing their charge, guess what stops? Your heart, right? But watch this. Don't blame it just on the heart. Don't blame it on the brain. You have to look at cause. What's the cause? Subluxation, your spine's ability to charge the brain, right? Now what's crazy about that is, when we talk about exercise, most of you guys think I want you to exercise because it pushes your organs to get stronger. Like the muscle of the heart is a muscle like a bicep, so I'm using my bicep all the time so my bicep's stronger. Yes, that's the case. But what Roger Sperry actually proved to us is that the exercise is actually more important in charging the batteries than pushing your organs to become stronger. Everybody there? Now what that just did is that should have just had you go, what does that mean for what everybody thinks about healthcare, how you fix problems, right? How you look at health or symptoms and then how you treat it. Okay, I know it's cheesy, but it's like someone just unplugs you from the matrix, and you're like, what? Right? Why, oh why didn't I take the blue pill? And it's because the reality of the situation is, if you want a healthy body, you just got to charge the batteries. Got it? And the problem with it is some of you guys have worked out, some people are working out, but you're not charging your batteries, and why? Because the windmill's kind of broken down a little bit, and we got to fix it. So every adjustment that you get, not necessarily just to make your back feel better, it's to do what? Help your every single tissue in your body be healthier. Got it? Which is why guests that are here tonight, I want to make sure every single person has an appointment to get your windmill, so to speak, checked, so that it is number one, absolutely the best. What about kids? What does this mean for kids? Literally, I put all these research articles together. Watch this. Central motor impairment, developmental impairments, learning disabilities, concentration problems like ADHD, behavioral problems, violence, increased illnesses such as ear, nose, throat infections, sleeping difficulties, wetting the bed, colic. All these things are linked to a decrease in mechanical stimulation, or what? Charging of the batteries in the brain, linked to what? Subluxation. Did you guys get that? Is there like a, I don't know. Anybody else excited to get adjusted when you hear that? So, all right. What are some of the warning signs? And again, for everybody here, most of you guys are patients in the office, but I want you to get this. For everybody that's around you, when they have these issues, they're not just issues. You know, you would not be driving down the road with somebody on like a 12-hour road trip in the middle of nowhere and have somebody's like check engine light blinking and things going, you just turn up the radio, right? You just wouldn't do that. In somebody that, I have people in your life right now, they're taking blood pressure meds, cholesterol drugs, doing injections and bioidentical hormones, and having headaches and acid reflux issues. I mean, did you guys see this? Speaking of things not to take, this is a research study that just came out that says if you take acid reflux pills, proton pump inhibitors, that Protonix, Prevacid, Nexium, Prilosec, depending on the drug, you're up to a 94% increase in first-time strokes. Did you get that? And they're over-the-counter acid reducers, right? Up to 94% chance of increased stroke. These are people that you know, that you love. And so guess what? If you need to, whatever, well, you got to talk them into it or whatever else, you just have to get them on the journey to taking care of themselves in a different way. Does it make sense? Right? Is that awesome? Okay, so what are the resources? Okay, let's go back. CoQ10, okay? It's the number one supplement for what? The heart muscle energy. Okay, heart muscle energy. Okay, but it's also for energy for all other things too. Next one is daily defense. Really helps with what? Antioxidant, because it helps with what? Inflammation. Everybody say inflammation. Helps with inflammation. Third one, Optomega, because it helps with the what? Omega-6, omega-3 ratio, which also helps with inflammation. Okay, but then vitamin D. In every single part of the cardiac cycle, that vitamin D is part of all the enzymatic reactions and all the rest. Yeah, and the probiotics. Good. Excellent. Those four. Most of you guys have magnesium, so I didn't include it in the bundle. But if you don't have magnesium, please get it. If you're somebody in here that's never taken magnesium, you're welcome, because you're going to sleep better, your legs are going to feel better, your muscle, you don't have cramps at night. It really is a lot better. So yes. Yeah.
How much magnesium is too much?
How much is too much? And that's a great question too. Guess how you found out you're taking too much? Anybody? Bowel tolerance. Bowel tolerance. You'll know the first time. So that's good. And actually, I didn't have a spoon. I have a glass that I keep next to it in my cabinet. And I accidentally left a spoon out. And one of my kids just cleaned it up and helped me in my bathroom. Grabbed my spoon, so I didn't have my spoon. So I just took the whole thing and kind of dumped it out into the glass and used the end of my toothbrush to kind of mix it up a little bit. And it was just a little bit too much. But I didn't know that until the next morning. So, yeah.
So if you're taking red yeast rice and trying to reduce cholesterol or whatever, should you stop that?
She said if you're taking red yeast rice trying to reduce cholesterol, should you stop doing that? And the answer is I'm not sure. It probably depends on the person. But I just go back to there's probably a reason the cholesterol is high. Also, red yeast rice has some other issues to it, too. And red yeast rice extract has some side effects to it that I don't necessarily like, so I don't prescribe it very much. But I would just go back to why is it high, and it may need to be high. A friend of mine's cholesterol went up to almost 500. I don't know if anybody's ever seen a cholesterol that high. It was almost 490 or something like this. And every doctor that saw it says, you're going to die probably this week, maybe today. Like, it was just like, it's horrible. But the guy rides like 100 miles a week on his bike, and he's thin, he's fit, he's doing great, but he's just not healthy right now. Something happened. Turns out about 4 doctors down the line, some alternative practitioner found out that he had Lyme's disease. And Lyme's attacks the nerve supply, and the body was trying to protect itself and increase cholesterol because the wrapping of every single nerve is, guess what? Just a fat myelin sheath. And Lyme's actually peels that off. And so the body was, he goes, listen, if you'd have taken a statin drug, you probably would, it's the worst case of Lyme I've ever seen. He goes, you'd have been dead in a month. He said, so thank God you didn't take the statin drug. It just didn't make sense to him that if my body's trying to increase it, I probably should not try to mess with that. Does it make sense? You just always want to work with the body. There's always something going on you don't know about. So good. Anybody else? Questions? Good. All right, let's pray it up. Father, thank you for today. Ask that every single person takes action. They get everything they need. Because of that, the people in this room, they don't have to deal with it. They reverse heart diseases they've had. The ones they didn't know about. And Father, the ones here never have to deal with that. Or the ones that hear from the ones that were here tonight. So God, I just ask a blessing that you bless every single person here with life, joy, health, peace. That there's stress here, Father, that I condemn that in the name of Jesus. That every single person here rises up. That they experience life to the full the way that you came to give. So Father, we love you and praise you. Ask all these things in Jesus' name. Amen.